Hello YouTube and welcome back. This is the Maine Prepper. Today we're having a look into our IFAK. This is going to be part 3, as it were, and this is going to show some more of the upgrades and additions. Now earlier I recommended we buy the kit from Skinny Medic, which I have here in my hand, and one of the things that you'll notice about it is that it gets loaded up pretty quick and you're not going to be able to carry everything in the world. So that brings up and segues into two good points. The first one is you can't carry everything in your IFAK. Your IFAK is part of a 3-tiered system, as it were, or level 1, level 2, level 2A, and level 3. Level 1 being, of course, the IFAK, and level 2 would be a CLS bag, Combat Lifesaver. Level 3 would be something more like a hospital or surgery. So you can't carry everything that would be in a surgery or a hospital in here, and certainly not all the gear that's going to be in an IFAK. You couldn't put, for instance, an IV bag in here and everything else that you need to carry along with it. As I've said earlier, this kit is broken down into 2 components essentially. Here in this back underneath are the first aid type items that we have, and the rest of the kit is the trauma kit. Today we're going to be replacing some of the original issue items that came with the Skinny Medic kit with a few more what I consider to be upgrades. So let's jump right into them and have a look. First I went down and I got a package of Band-Aids, just very inexpensive ones. These are going to go into the first aid kit. It's very important when you're out there in the field that you don't have little things, minors, turn into majors. Covering little cuts and scratches up and treating them with some sort of a betadine or a tea tree oil or something similar that's an antimicrobial is going to be essential to keep little tiny cuts and scratches from turning into infections that can be debilitating. Here we see something that is essentially, it's a butterfly closure end. Let me see if you can see that through here. Better yet, let me pull one of these out since they're rather cheap. This is a Band-Aid, and all it's done is it's a piece of Band-Aid that's cut in notched on the edges, and it's designed so that you can pull the flesh together on 2 sides of a cut or a wound to help it to heal more quickly. That being said, the best thing for healing a wound is clean air on it, not covering it up. And therefore having this butterfly type enclosure shaped the way it is going to be essential to allowing the maximum amount of air to get on that gaping or wound or cut. Concurrent with that, you may need to stitch a wound up though. And to do that, rather than carry around a bunch of surgical needles and thread, what I have here are, they're marketed on eBay as a practice suturing kit, and you can see the contents of one of them here through the clear bag. All it is, it's about 30 inches of silk thread, and it has a needle, curved needle, just like this. And if you want to see how stitching is done, I'm not going to do it for you here, but you can go down to the hospital. Better yet, if you hang around with me long enough, you'll see somebody stitching me up at some point or another in the next few months. It always happens. I always get hurt. I've been stitched on, I think, more than a Raggedy Ann doll. So here we see the inside of it, and it's just 30 inches of silk thread with the needle, and it comes in a very, very thin packet, and this is going to fit perfectly into our CLS bag. If you have a surgery or a CLS bag, you may want to get a collection of needles and some actual catgut or suture type thread. But in the interim, these are kept clean, sterile, and ready to go. They are threaded up. You don't have to mess with anything. You just take it out and you go. You start stitching. So I like that, and they're about $1 a piece on eBay. Now we already have a pair of good surgical type trauma scissors in the bag, which are designed for cutting through clothing and etc. That being said, it's hard to cut through the seams of like blue jeans and things like that. So be careful not to break your trauma scissors. These are the trauma scissors. These are not really going to be very good for doing smaller work, including cutting little pieces of flesh away. If you're going to be cutting away on somebody's flesh or anything else, be careful that you have your stuff clean, all right? Sitting in the bottom of your CLS bag and wiping it off on your pants leg, that doesn't make it clean. Take some of this betadine soap, we'll show you in a second, and we'll wash it off with that. But I have here a surgical tool, and this is a very inexpensive one, and I'm not intending to do surgery out in the field. But this is just simply the holder, and these are a pack of surgical blades. An X-Acto knife can work just about as well, although these are sterile in here at least somewhat. That being said, I would still try to clean them off before I use them. If I'm working on you out in the field, and you have a giant callus or something I need to cut off, or there's a piece of flesh that has to be removed, if I've got a lance of boil or anything else, these surgical blades are what I would use. And again, I like these because they're very flat and very thin and very lightweight, and they're going to all fit inside the bag, and I'm going to show you how we put it together a bit later. Right now we're just doing a breakout. These are what are called Israeli bandages, and these are essentially 4-inch gauze compresses, and you can see a video on what they look like up here at Skinny Medic's site, and I've got 2 of these in here which are the 4-inch type, and I'm going to be using these to replace some of the regular bandage material that's in the CLS bag. And these are come ready to go, and all you do to get one out is you find there is a little tear place on them, and you just grab and tear. This one here you can see a little bit better. There's a little perforated hole. You grab there and you tear. And you take the bandage out. When you take the bandage out, and you'll see this in his video, don't put your hand on the side that's going to go against the wound. Put it on the back side. Now, looking on the back, you'll see a little trick that I have here, and this is a tip from the top. This is how I carry extra pieces of duct tape. If you have a sucking chest wound or anything else, or even you want to hold a bandage on a little better, you'll want some duct tape. Obviously, carrying this around inside of your CLS bag is a bit bulky. I don't recommend that. Rather, you carry like so. Now, you can layer 5, 6, 7, 8 pieces on the back of each bandage. But remember, the key about using the back of the bandage is not to bind up where you won't be able to tear the top corners off this bandage and get the bandage out easily. So I've laid it right across the back, and you'll notice I folded back the end so I can grab it with my finger. And all I've got to do when I want to pull off a piece is do so. And I can layer this 1, 2, I've got 2 or 3 on here just for demonstration today. You want to use a good duct tape because you can reuse this, obviously. Once you put it on the wound, you don't want to reuse it. But if you stick it on the back here and it's the really cheap stuff, when you pull it off, it won't have any more stick left. So this will have stick, again, if I use it in another place. But remember, don't tape over the ends of the bandage. Otherwise, you won't be able to get your bandage out of the wrapper. And that's going to be defeating the purpose of having these in individually sealed bags. Here I've got a triangular bandage, and this is a Army surplus issue type. Get this on eBay again for a few bucks. It's an upgrade to the cravat or triangular shaped bandages that are already in this kit. When I get done, I'm going to pull out all the pieces that I'm essentially discarding and putting into my first aid kit and show you what these are replacing side by side. But I'm just doing a breakout right now. Okay, next we have a couple of essential oils. Now, there are a lot of essential oils out there, but these are the 2 that I recommend, and for 2 different reasons. There's a clove oil and there is a tea tree oil. Before tea tree, they were using phenol, and that was an antimicrobial. Well, tea tree was essentially supplanted by modern antibiotics. And if you have access to that and you're wounded, believe me, use the modern antibiotics, all right? But these are great. They used to make a poultice out of these. The natives did, I think in Australia, and out of leaves. Well, now they have this concentrated oil, which is even more effective. I use this for a lot of things. It's an antimicrobial that really works. It's inexpensive, and I've got a bigger bottle around the house that I got at Walmart for like a few dollars. This was a little bit more expensive. I think it may even be organic, I'm not sure. It was about $3, but it's in a hard glass bottle. It's thick, thick, thick glass. It's not going to crush inside of my rucksack or inside of my CLS bag. Clove oil, this is great if you have a toothache. And believe me, you get a toothache out in the field and there's no dentist around, you don't want to have to go weeks or days without seeing some sort of relief to that. You put a toothpick in here in the end, or there's a little dropper I think that comes inside. I'm not going to open this because it has a seal, but there's a little dropper in here, and you put just a tiny drop on the affected area in your mouth. It can be for gum sores or anything else. It's very effective at deadening the pain. And you may say, well, that's a lot of clove oil to carry. Well, you get a toothache and you have to go several days in the field. I've had to do that before. Couldn't get back to the dentist. And there you have it. And last but not least is good old betadine. And those of you that have been in the military long enough to know will recognize this by its nickname, monkey blood. and this is great stuff. It's a surgical type soap. When I cut these fingers off, they soaked my fingers in a solution of betadine with some water for, gosh, I had to wait 14 hours before I went into surgery because they were kind of busy that day. It was the day for cutting fingers off, I guess, and I was the third in line. And this is just a small, I think less than an ounce bottle, 3/4 of an ounce, something like that. Anyway, this is a great disinfectant. It's essentially a povidone iodine type solution, and it's very effective. You can mix it with a little bit of water and with a little bit of soap. On the note of soap, an option may be keep your hands clean. If your hands get dirty and you rub your eyes or anything else, you're getting essentially germs and dirt in through your subcutaneous tissue or in through your eyes. It's getting directly into your bloodstream and getting into your body. It's going to make you sick. Always try to keep your hands clean. This is a little bar, tiny bar of soap. This is the kind you would get a free sample or whatever, like at the hotel, and just stick it in a tiny plastic bag and it'll slip right up inside next to my Band-Aids inside the bag. All right, let's open up the bag here next, and we're going to have a look at side by side what these items each replace from the original kit. Now, as you can see, here's what's coming out. We're taking out the last of the triangular bandages that came with it. We're not throwing any of this away. This is going to go into our CLS bag or our household first aid kit, whichever one you have. If you're operating as part of a team, you're going to want to have a good, robust CLS bag, and we'll get into that a little later. Try not to get under the illusion that somehow you're going to be able to carry an entire surgical hospital kit inside of here, okay? On that note, a lot of people will go out and get these full-blown blowout bags. That's fine with all of these different types of equipment in here, and yet if you don't know what's in there and nobody around you knows what's in there, it's essentially useless. I'm not saying to not get a full-blown kit going, and we will do that as time goes on, but I want to make sure before we get too far ahead of ourselves, we understand that using some of the equipment inside of here can actually be counterproductive. Case in point, tourniquets, and we're going to get into tourniquets probably in our next video. You can actually mess somebody up by putting a tourniquet on wrong, and I don't just mean putting it around their neck for a head wound. I'm talking about putting a tourniquet on when they don't need one. You can actually cause them to have their arm or their leg or appendage amputated because you put a tourniquet on unnecessarily. That's why I often question people that have 3 and 4 tourniquets on their CLS kit or inside of their IFAK, why they have so many. What are they planning on? This tourniquet we have, by the way, is designed so that we will have a method of applying a tourniquet to ourselves, and we'll have it set up that way. Otherwise, you can use one of the many field expedient tourniquets that I'll show you if you have multiple needs for a tourniquet all at once. Let's hope not. That's a really bad day if that's what's happening to us. So here's what is coming out. Triangular bandage, and we're taking out all but one of the gauze sponges and all but one of the abdominal pads. There's still a need for one. Now you can start getting into the what if scenario a little too much with your IFAK. Keep in mind, we have limited territory here, okay? We have limited real estate to fill, and I recommend we go with this size IFAK because otherwise you wind up carrying a full-blown medic kit each person, and that's not necessary. That's going to be very redundant, and that's also going to be very counterproductive, especially if you don't know everything that's in there. I mean, goodness gracious, how many tourniquets do you really think you're going to need? If you have both of your arms blowing off, who's going to put it on for you anyway? Hopefully there's somebody around that can put on 2 tourniquets. Chances are they'll be able to use one of theirs if that's an unusual situation that happens. And that does happen in combat. People run over an IED or something and they'll need more than one. Of note, what did get left in is the quick clot. This is great stuff. And also 1 gauze sponge and 1 abdominal pad. Now we're going to put everything back together and I'll show you how it all looks. And you may say, goodness, that's a lot of stuff to supplant with this. Yes, it is. But with clever packing, we should be able to get it done. Right, first we want to turn the bag inside out. Take all of the pieces out that are falling out anyway. And this will allow us to get full access to the back part where the first aid gear goes. In the back, we're going to put the first aid gear that was there from the last video, and we're also going to add, I've put all of the suture material as well as the scalpel and blades. You'll notice I put a piece of tape over the end of the scalpel blade. That way it doesn't poke a hole in my Ziploc. I try to have everything subcontained in little Ziploc bags. What we're going to do now is we're going to be able to insert this back up here. All right. and fold the end under like so. We're going to I took my essential oils and I put some duct tape around, leaving a little tab so I could pull the duct tape off inside of this plastic bag up with the soap. This won't hurt the soap if it leaks on there. Although taking a bath with this bar of soap and clove oil might be a little bit uncomfortable. And of course our Band-Aids will slide up in next. Now you may say, well, suturing, really, that's more than first aid. Yes, but it's not going to be something that you do during a trauma situation. If somebody's shooting at you guys and you're out in the middle of the field and you're trying to get yourself together, you don't want to be doing suturing there. Your hand needs to be kind of steady when you do that, right? Okay, and we can also put our betadine up here on the first aid side. It's really not a trauma type item, although you may want to pull it out and use it during a trauma situation. Now, we can turn the bag around, and our gauze and everything else is going to go in the back side here. I want to put these up behind our hemostats. Now our scissors are something else that we will want to put in here, but before we do, we'll want to put a piece of tape over the end, okay? Because you don't want this poking a hole. Fold yourself a little flap so that you'll be able to get the tape off. Don't put it up against itself too much, okay? Slide your scissors back either behind here, which is a good place for them, or on the first aid kit side. If you have some of your gloves, they will also stuff neatly up behind these two pads. Now in front or in back, you can put, you'll notice I've taken my 2 Israeli bandages and I've put my 4 or 5 pieces of duct tape on there. They'll fit either behind or in front. Either way, you just want to be able to get a hold of them. I like being able to put everything back here in the back. It tends to hold it together just a little better. Now we want to put our tourniquet where we can get to it easily, and I've got it up in the top. Wherever you put it, it doesn't matter, as long as everybody on your team knows where it is and they can get them out quickly without having to dig around in the dark. Downrange, I know 10th Mountain SOP, and I think 101st did this towards the end of my tour. You carried in your right sleeve pocket. That's up on your jacket, and it has the red tab, and they wanted the red tab hanging out so everybody could see it, and everybody had them set up exactly the same way, so if you needed to get your tourniquet out, people could get it out for you quickly and apply it. And when you think about it, that's to your complete advantage, because you don't want to have a situation whereby you're bleeding out, because people can't find a piece of equipment that you're responsible to have secured. Now this is going to be a very tight fit, folks, and you're going to have to do a little bit of adjusting as you go along. So don't get too wrapped around the axle if it doesn't fit in exactly the way you want it to at first, but it's going to fit eventually. Now I'm going to put my quick clot up here in the front of all of these so that I'll know where they are and I'll know where it is. Put the things aside I don't need. I'm probably not going to have room for the hand sanitizer in here. Also in my first aid kit, don't forget the betadine povidine pads, which are there. And again, if I didn't have room for these, remember I have a bottle now of betadine, but I do have triple antibiotic cream in here, and so I'm going to want to try to fit this in as well. And now we're starting to see we're getting pretty tight, aren't we? And last but not least, I have some of this 3M Veltrap, and this is a really good bandaging material, and that has to go in there for me because that's an essential item. Now this is going to fit, it's just going to be a really, really tight one, so our IFAK is going to be quite packed. So if you want to watch the unpleasantness as I try to squeeze all this stuff in there, hang tight. I'll try not to bust out into a sweat as I do this. One of the things I try to avoid is getting a bigger and bigger and bigger kit and a bigger and bigger and bigger rucksack. I try to get something that I know that I'm going to be able to carry the size ways and stick with that and make that work. Make everything fit. Now there's room for a few more items, which is good because some more items are going to go in this kit. There, I showed you the process so you'd realize it wasn't just smoke and mirrors. And I've got everything in here, and I can actually put this hand sanitizer back in as well, which is good because I am very big on not letting minors turn into majors. All right, folks, I think that about covers it for this part. There'll be some additions later on, but the next thing we do, we're gonna, and this is pretty fat looking, okay? The next thing we're gonna do is we're going to get into the individual items in here, and we're gonna start looking at how to do them and how to use them, and also how to do field expedients with the equivalent thereof. And we'll start with tourniquets because that's one that concerns me. A lot of people don't understand tourniquets and they're going to be misapplying them, leading to needless amputations later on. Thank you, folks. This has been Maine Prepper, and stay tuned. We'll keep rolling.